We are Today's Dental Consulting, and we offer a free practice analysis to any interested open dental office. What I'm going to show you in this video is some of the things that we look at when we do that analysis. The single most important metric is obviously your income. This is what you really want to focus on. This is what you use to pay your bills and yourself. These other factors are important, but only as they contribute to the income. I'm going to go pretty quickly through several different metrics and several different practices that try and illustrate some of these points. Keep in mind that we give you this Excel spreadsheet as part of the analysis, and you can drill down clear to the patient level on these reports if you wish. So we want to look at new patients and, more importantly, patient retention. This is called our mantra. What it does is look back the last 30 days and see how many of those patients scheduled their next visit, how many paid at that appointment, and how many did you collect email, referral source, and cell phones for. So this is pretty good. We want all these to be above 90%. Another metric that we really want to concentrate on is how many of your active patients, defined as the number of people you've seen in the last 18 months, have their next visit. In this case, we got 75%. That's pretty good. Look at this practice. Okay, their mantra certainly isn't very good. And you can see they've had a good number of patient visits, but of those, only 370, 24%, schedule their next appointment. People are running out the back door in this practice. We have several metrics that we look at to evaluate the effectiveness of offices' collection systems. What I wanted to point out is the way we calculate these percentages, which is a little different than a lot of people do. For example, the estimated insurance of $32,000 is 23%, not of the total AR, but of the average net production for the office. Look at the total AR, that's 70% of the average net production. Likewise, the balances over 90 are 19%. We'd like this to be below 20%. And the patient portion over here is 47%. We'd like these guys to be below 50%. So this office is doing pretty well. When we compare this office we just looked at with this office down here, you can see that this office is really struggling. They're losing a whole lot of money, and they can't afford to. This is not a high-producing office, and yet look at that accounts receivable. They need to get this under control. So one of the tools we have for that is what we call the AR manager here, and that's where these statistics come from. The AR manager is a report that's optimized for the best way to spend your time working the accounts receivable. People are busy. They have a finite amount of time. So this already sets some priorities. You start at the top of the list and you work your way down. That's the way you get your most bangs for your time spent working AR. So let's look at the top 20 office procedures ranked by the production that those procedures bring in. So we got crowns up at the top, then ortho. We can use these slicers. That's what these blue guys are called. And I can click on that and just look at the doctor. Okay, what procedures does the doctor do? I can also go over and look at the hygienist either individually, or when I hold down the control key, I can look at both those hygienists together and see what procedures they're doing. The office needs to be very adept at dealing with these top 20 procedures. We can also select the individual procedures that we want to look at and see how do these different procedures compare to one another. For instance, how many prophies compared to how many perio maintenances. Also, we can look here and see they're using the incorrect fluoride code there. That's the old code. Over on this side, we can look at case acceptance by hygienist. And there's a considerable difference here. This is someplace where you may want to drill down and see what's really going on. Socrates supposedly said that the unexamined life is not worth living. I'm not sure if that's true, but I can tell you that the unexamined practice is much less profitable and much more difficult to operate. So doing an analysis like this really can be very beneficial. As I said at the beginning, the analysis is free and you can sign up for it 24/7 using a little scheduling button there on our website. Our website is todaysdentalconsulting.com. That link is active down there. You can also take a picture with your cell phone of that QR code down in the lower right-hand corner, and that will take you right to our website. So if you liked the video and found it helpful, please give it a thumbs up and subscribe so you see our other videos as they come out. And click on the little bell icon so you're notified about the new videos. You can also click on the little arrow and share this video with your friends. Hopefully this has been useful and interesting for you, and if you'd like to schedule a free practice analysis yourself, again, just go to our website.